Dr. Cassi from NAVC's Vetfolio and the host of Vet2Vet. So much has changed in the last 5 years. The explosion of AI tools and telemedicine has massively changed veterinary medicine. And yet the underlying motivation stays the same. We want to provide good medicine for our patients. Here to talk about the future of blending good medicine and the likely exponential growth of AI and telemedicine is Dr. Shadi Ireifej. Dr. Ireifej graduated from the Cornell University College of Veterinary Medicine in 2006. He's a diplomate of the American College of Veterinary Surgeons, and in 2019, he launched Vet Triage, on-demand virtual vet visits. And Dr. Ireifej, you did that at exactly the right time in history, and I know you have some thoughts on the future of veterinary medicine. Really looking forward to talking about that with you. Thank you so much for joining me.
Thank you for having me. It's great. Thank you.
Yes. I'm so excited to hear your insight on some of this. And kind of starting with telehealth, this is a term that gets thrown around a lot, but I understand there's a lot of, sort of an umbrella when it comes to talking about telehealth and telemedicine. So can we start there with what exactly is telehealth?
Absolutely. In fact, my first sign that someone who's trying to talk about this subject doesn't really know the whole thing is when they use telemedicine as the all-encompassing word that'll include everything. So right off the bat, I'm like, oh boy, okay. So we got to start from the basics, which is fine. We want to make sure we spread education and make folks less uncomfortable with this new modality. So telehealth is the overarching term. Telehealth means that you have a provider and a patient or a client, and they are communicating together over some sort of geographic distance. That's telehealth. So it includes anything underneath that are all subcategories of telehealth. So telehealth can then be broken down into telemedicine, telediagnostics, teletriage, teleadvice, teleconsulting. All these different teles are underneath the category, the umbrella, as you pointed out, of telehealth. So each one of those categories has their own definition. Telemedicine, for example, includes the creation of the veterinary client-patient relationship in order to have that modality be ethical and legal in that situation. Teletriage, do you have an emergency or not? We're triaging. Teleconsulting, usually between like a specialist and a pet owner or between veterinarians who are talking about a case. So they all have their own definitions. And then with all those definitions, they all have their own restrictions or nuances. I will also reiterate that all of these definitions are prone to changing because we've already seen since COVID, especially, that these terms, this modality has evolved substantially. And so it may be these definitions get mixed around. Maybe we're going to recategorize them, redefine them, allow more, allow less. We'll have to see how that all goes.
Yes, absolutely. And like you said, it's really evolved rapidly over the last several years, thanks to COVID in no small part. And so that makes sense to really kind of keep our eye on the ball and see how things continue to change over the next several years as we're implementing all of this. I know something, big question that always comes up when we're talking about telehealth is the legal consideration. What can we legally do? What's going to get us in trouble when it comes to telehealth? So can you talk about some of the legal considerations around telemedicine?
Sure. So first, some foundational elements. Number one, we all recognize the veterinary field in general tends to be behind the human side of things, human medicine, right? We're at least 10 to 20 years behind human medicine, depending on what country, where you are in the world. Then on top of that, legal change comes about very slowly. Also, a lot of the current statutes may not be, probably won't be applicable in the future when it comes to veterinary telehealth. So keep in mind, it'll be an evolving process. Even if you look at how certain statutes are described, they'll still use the word telemedicine to mean anything virtual, which we already established is really not most accurate. So they have their own learning to do and their own growth to go. So I want to make sure that's prefaced prior. So in regards to legalities, it all centers around the VCPR, veterinary client-patient relationship, and that's defined as the physical interaction between doctor, client / pet or animal and in person. And so that relationship is an agreement. It's an agreement on the doctor's side that they're going to provide the best possible care. They're going to be able to diagnose, prognose, treat, follow up, and be available if there's an emergency or have some sort of option for emergency coverage if that particular doctor is not available. The client is agreeing to follow doctor's instructions, pay their bills, be a compliant pet owner. And so that's the agreement that's established with VCPR. So most folks are nervous legally about telehealth because they don't know where VCPR stands. We are seeing more and more states, and it'll probably end up being, if not all the states, most of them, allowing for what's called a virtual VCPR, where you can establish that relationship, that contract, that agreement between you as a practitioner and the pet owner virtually. And so that's cool. That's a huge move in the right direction, I feel, when you're trying to increase the access to care, spectrum of care concepts. So until it becomes full on across the nation, right now it ties into if you're providing virtual care within a brick and mortar facility, you're typically doing that with your own clients, in which case you already have a pre-established VCPR, or you plan on establishing one before you continue that relationship virtually thereafter. That relationship duration is dependent on location. Most states in the US will say around 12 months typically, but it can be longer, shorter, depending on what you're talking about, or what region you're talking about, rather. But you're allowed to have that virtual VCPR once the in-person VCPR is established for X number of months or whatever it is. Any other tele category underneath telehealth, pretty much right now as it stands, with some disagreement, does not require that VCPR to be established beforehand, in person or virtual. It is simply a modality that fills a certain niche. Teletriage, for example, we're triaging. Do you have an emergency or not? There's no VCPR required. That's pretty much well established. Some will disagree, but the majority of the profession agrees that that's been an established thing. Teleadvice, giving general advice to a pet owner about their pet, or not even about their pet really, but about a condition or a situation, right? That doesn't require VCPR. It's purely advice. So the easiest way to separate this, to kind of recap that, is the VCPR comes into play for providing telemedicine, which is typically out of a brick and mortar, which is going to be already, the VCPR already has been established preemptively, or that's the first step in order to continue virtually with that client. All the other telehealth categories, VCPR doesn't really play a role.
Okay. And now my wheels are turning, and I have questions. So where is the line between telemedicine and teleadvice, and how does prescribing play into that?
So there is a lot of overlap between these definitions, right? I'll give you an example with vet triage. This is a common one. You really can't have teletriage without teleadvice. So if you're a veterinarian and you're telling a pet owner, hey, good news, not an emergency. Okay, the pet owner's next question is going to be, well, what do you think it is? What should I look out for? What can I do? So now you've went from triage to now advice. So I always preface this with veterinarians that I interview and other platforms like yours, that teletriage is almost impossible to have without having tele-advice, at least in our profession. I don't know about the human side, but in our profession, it's impossible, right? So there's crossover there. Tele-advice, to your question, is supposed to be generic, non-specific information about a condition involving animals in the veterinary space, right? And so, sure, that comes in handy. You could talk to a pet owner about obesity in dogs in general, right? Even though they're really asking about their own dog that's overweight, what can they do, what can they look out for? You're speaking on behalf of all dogs in general, in the profession, both anecdotally, your own expertise, as well as what's in the medical literature about obesity. But that pet owner is going to take that information and apply it to the best that they can to their own pet. This is the equivalent, in my opinion, to somebody going on Google and searching obesity in dogs, weight loss in dogs, right? But the difference is you have a veterinarian telling you what the advice is. And so the question then becomes, how specific does it have to be to no longer be tele-advice? And who knows? I mean, it's such a nuanced, case-specific thing that you can't have it be one definition where all of a sudden there it is and it ends. It's going to be a gray zone. So I don't have the answer to that. I don't think anybody does, which is also why, to some degree, some of these nuanced categories might be a bit ridiculous in terms of what's actually happening clinically. That's basically my point, is that these definitions, although they sound nice on paper, they sound great, we're discussing it, In reality, it may not be as useful as we think, and it probably serve to cause some level of confusion, which is why I said these are probably going to evolve over time, because I can see some consolidation happening between some of these terms.
Yep, that makes sense because as I was listening, I'm going, okay, so you could, from the tele-advice standpoint, say, well, diarrhea, GI upset, feeding a bland diet like boiled chicken and rice can help, which sounds like it's falling on the advice side, but oh, you can go ahead and feed him a bland diet of boiled chicken and rice is more on the telemedicine side. So yeah, it sounds like there's some a very a moving target and as far as where the line is.
That's a great way to describe it, actually. Moving target is exactly right. And I think that all of this stuff gets pretty much overshadowed by the fact that we don't acknowledge one very basic premise. We ought to trust the judgment of our veterinarians. We should trust our colleagues to decide when virtual care is useful and when it no longer can help in that situation, right? So if you're trying to talk to a pet owner about diabetes and diabetes mellitus, and the questions are becoming so specific that at some point the veterinarian says, look, I need diagnostics to tell you anything more. That veterinarian has now decided my tele-advice has ended. You need to seek out in-person care for possibly blood work, radiographs, whatever, right? And so if we trust our veterinarians, then a lot of these nuanced rules and definitions become kind of obsolete because we're trusting our colleagues who have agreed to an oath, a veterinary oath, to provide the best care ethically, legally, et cetera. And that's where a lot of this stuff ends up. That's where I get on my soapbox, because if we trust our colleagues, then a lot of these nuanced gray areas becomes obsolete because we trust our colleagues to make the right decision.
I think that's a really good point. As we're kind of navigating this new world of veterinary medicine, we can talk about principles and this and that, but really it comes down to these are our colleagues that we're working with in different capacities. And so I think you make a really good point about trusting each other.
You have to. And if you want to make it about medical board complaints, I mean, there's virtually, for all intents and purposes, zero medical board complaints on the telehealth side. There will be eventually. They're going to, it's bound to happen. But compare that to the brick and mortar side. It trumps it by a huge magnitude. And so even with regards to like risk factor of bad medicine or unethical behavior, it seems like brick and mortar has a problem and not telehealth, just from the standpoint of medical board complaints and how risky telehealth really is on the legal side. So that's another premise to sort of compare the two sides, brick and mortar versus virtual.
Well, and I think you're bringing up some good points here of when it does come to board complaints. And I'm glad that you brought that up because my next question was, what are some of the limitations of telemedicine and telehealth? But I think part of the point I hear you making here is when we're worried about things like board complaints or just unhappy owners in general, whether it's social media or whatever it may be, a lot of it comes down to client perception. And, when it comes to telehealth, while we may feel, I want my hands on this patient, sometimes that's where it's this fine line because feathers can get wrinkled that way and we can get, angry people. And that's where scales can tip. And so, back to that moving target to say it's really maybe not the moving target that applies here, but just a very fine line that we're walking in this regard.
Veterinarians are usually fantastic at client communication. We have to be. We can't talk to our patients. We're talking to the animals. And so a lot of us are, whether we hate it or not, are really good communicators with people, right? And so a lot of this staying out of trouble as a veterinarian involves adequate communication with the pet owner. They have to understand preemptively, and in some states they call these guardrails for virtual care. They have to understand before they sign up to talk to a veterinarian what the limitations are of that exact modality. And that's part of like a consent form of this, like on Vet Triage, we have a disclaimer that explains what we can and can't do. And so the clients have to read that and acknowledge it before they sign up to speak to one of our doctors on video. So the communication part of it gets you out of a lot of trouble. Secondly, on the consumer side, pet owners grabbed this modality by the horns and went with it, right? Like clients are used to FaceTiming and Zoom calls and whatever else. They have it all in the palm of their hands. They can do it anytime, 24/7, very inexpensive, quite accessible. Clients have no problem grabbing onto this and running with it. When you talk to them about vet triage, for example, they're like, well, that makes sense. I can do that with my own doctor or my kid's pediatrician. Why couldn't I do that with my animal's doctor, my pet's doctor, right? And so consumers don't have the problem with the hesitation. It's us and the profession that are nervous about new things because we are inherently difficult. We don't like to change things, in the field. So anyway, so I think to get yourself out of trouble as a veterinarian, it's clear client communication, either unofficial or official guardrails are set up, and then from there, you can't help a client that won't understand anything. But most clients are sensible people who get it and move on. Any pet owner should understand that you can't run blood work or do surgery virtually. It's not a modality yet. It's not a modality yet, and so, most people have that common sense and know it's our job as veterinarians to communicate effectively with clients so that they understand what I can and cannot do.
Sure, sure. And I think more so than not wanting to change things, and I'm sure there's an element of that there as well. May also inherently cautious. And, there's that concern of, yes, you can do this with your own doctor, but you can also tell your doctor what's going on, whereas your dog can't tell me what's going on, and you may interpret something different from what I'm interpreting it as, or what I would interpret it as if I had my hands on this patient. So that's where, I think that the question comes in of limitations of telemedicine. So, you've talked a lot about trusting each other as colleagues, which I think is a great message that we all need to just kind of remember in this new world of medicine. What are some of the other limitations you've encountered when it comes to telehealth?
So let's tackle that. Let's tackle that our patients are nonverbal, right? We are trusting the caretakers to speak on behalf of their animals. The common comparison on the human side is pediatrics or anybody who's nonverbal, but a mom or dad is talking to a pediatrician on video on behalf of their child who can't speak for whatever, either pathology or just they're too young, but they can't speak. So to me, I'm not sure I see much of a difference there. If that pediatrician feels comfortable and his or her colleagues in that field are all like, yeah, no, that's cool, telehealth with kids, right? It makes sense. Then I'm not sure why it'd be any different with animals. So I think that's part of I think it's just an inherent part of the deal, and I don't see that as being a problem. The second thing with regards to limitations with telehealth is we know that clinically that probably 90% of your diagnosis is coming from your history. And then the other 10%, I'm guessing, this is just, anecdote. 10% are based on diagnostics to prove or disprove what you thought as an experienced clinician. This patient has these clinical signs. You're thinking it's got an endocrinopathy. Maybe it is diabetes mellitus, but you're not going to just start treatment that way. You want to prove it. And so then you try to prove it with the diagnostics. So if anything else, if not for nothing, virtual care relies heavily on veterinarians being experienced veterinarians who know how to indulge an adequate history to try and figure out, based on their experience, what it is most likely that's what are some differentials that might be bothering this patient. Is it an emergency or not? Whatever your goal is with that modality, but history is a huge part of it. The limitation part of that is, of course, we can't use our hands. We can't provide a physical examination yet. We'll see what the future holds with that. But as of right now, on Vet Triage, for example, because we are 24/7 live video, we leverage the client's hands to perform the physical exam. Not as good as a veterinarian doing it, not as good as a veterinary technician or nurse doing it, but better than nothing. We can try and direct the client that way. So your physical exam is limited. And then the final limitation will be diagnostics. You can't run blood work, urine tests, surgeries, radiographs. Those things are not a possibility. In terms of prescribing, that's a very interesting one because I've run into now multiple scenarios where there's a disagreement about whether or not even recommending over-the-counter products is considered prescribing. Whereas I've always thought, and I think the majority of the profession believes that prescribing is defined as a doctor giving a client or pet owner a script, and then that script is being brought to a pharmacy, whether it's in person or from an online pharmacy, and then they get the medication because of that. So even there, we're still running into problems where folks are not agreeing on what prescribing actually means. But as far as I'm concerned, anything that pet owner already has access to, usually over the counter, but it could be leftover drugs that were prescribed previously to other people or pets in their family. If the client has access to it, then that pet is at risk of that client Googling that product and using it or misusing it or using it inappropriately for that scenario. So if that's going to happen anyway, my belief is a veterinarian should then direct that measure instead. So I believe that veterinarians should have the ability to leverage whatever the client has access to them at home, especially if it means saving them the emergency visit, being able to make that pet feel better, making that client feel better in the meantime with fairly benign drugs like, diphenhydramine or famotidine, right? Just, over the counter stuff. But then you have places like the UK where it's a huge no-no. You can't even do that over there. So again, these things will hopefully evolve. But in terms of prescribing, though, if we agree that that my caveats here, my definitions are not considered prescribing, then of the things that we are going to manage virtually, probably 90% can be handled that way until they can see their family veterinarian in person or go to the ER in person, right? It helps band-aid things. Actual prescribing is still it's still something that needs to evolve more. I'm not sure with the advent of virtual VCPR, theoretically, that should be able to permit the veterinarian to prescribe things, but I'd have to look into what the newest and latest is on that. Because on vet triage, it's not our goal to prescribe anything. I tend to sort of leave that on the sidelines. But theoretically, if you're going to title something VCPR, that should allow you to some degree to be able to diagnose, prognose, treat. And so we'll see where that goes. I will circle back to we should trust our colleagues, because I don't think any veterinarian with a patient on video, let's say, in a state where virtual VCPR is okay, and this patient is showing all the signs of Cushing's disease, I doubt any veterinarian ever will just prescribe trilostane without a thought. We veterinarians wouldn't do that. I trust my colleagues to not do crazy things like that. We're not going to treat a dyspneic a 13-year-old Chihuahua for heart failure just preemptively virtually, right? So it goes back to trusting our colleagues.
Sure. And I could see in some of these scenarios, it actually helping get pets into the clinic in some situations. So, to your example, a dyspneic 13-year-old Chihuahua, to say, well, you really need to take him in to see your veterinarian, your family veterinarian. Person saying, why? I'm on the phone with you right now. You can see what he's doing. Why can't we do something? And trusting our colleagues and leaning into those communication skills to explain this is the value and what you're going to get with this in-person visit, and maybe bolstering some of those in-person visits as well.
I love that you said that. So on vet triage, for example, everybody has to go somewhere else. You're either going to go to ER or your family vet. You can't stay here. You got to go somewhere, right? That's a rule on the platform, and our paperwork reflects that when we send the medical summary to the pet owners. I do think, absolutely to your point, that leveraging telehealth in this manner increases the client loyalty to go back to their family veterinarian for a number of reasons. Number one, they already spoke to a veterinarian who's assured them that it's not an emergency, but it could be a bunch of things. I really want you to follow up with your veterinarian. You need to do probably blood work, radiographs, ultrasound, whatever. So right away, you're packaging that case with that client to go. The second benefit to it is if you can save that patient, that client, from going to a stressful and usually expensive emergency visit, those finances can be refunded back to their family vet. Right. And so that you won't have pets skipping out on vaccines and heartworm prevention and flea and tick prevention because their budget got blown at last week's emergency visit that turned out to not be an emergency, but now they're stuck with a $500 bill. Right. So by saving them financially, we can get them back to their family veterinarian. So those are two very potent benefits to getting that, to improving client compliance with following up with their family veterinarian.
Sure. And I think you're speaking to this already, but kind of where my head was going next is why is telemedicine important, telehealth important? And I think you're speaking to that. Are there any other, big points you want to make in terms of why you feel very strongly that this is an important part of medicine?
Access and spectrum of care. That's the answer to that question. We have, any clinician has known, even before the pandemic and these phrases being popularized, that medicine has to be tailored to what the client is willing and able to do, right? With some exceptions. I mean, if you have a puppy with a gastrointestinal foreign body, I mean, unfortunately, it's either surgery or euthanasia. There's not much you can do. But most cases, there's a spectrum of care you can offer that pet owner, and they can decide based on their own finances, their culture, their pet, all that stuff. They take all those factors and say, okay, doctor gave me three different plans here. I'm going to pick one and go with it. That's a spectrum of care aspect to it. What telehealth does is it adds to that spectrum of care by increasing access to care. If you're a client who doesn't have finances for an in-person visit, doesn't have a vehicle, you can't drive, you live on an island, there's no veterinarians, or you live really remotely where the next veterinarian is a plane ride or a ferry ride away, by providing virtual care, that pet owner now has access to a medical professional who can meet, yeah, sure, that professional can't do diagnostic surgery, et cetera, but hell, education is a very powerful, very valuable a benefit these pet owners get from that interaction with the veterinarian. It's huge. It's huge. Buys them peace of mind. They get real advice. They know what to do next. And then if we are allowed to prescribe, and it's a simple pyoderma, the skin, or a stress colitis, we can give you some medication, see how that does until we can get you to a veterinarian in person. So it's all about the access to care aspect to this, and then the spectrum of care aspect to it, which sort of ties into our client communication that we mentioned prior, and it also ties into new grads as well, being able to speak to this nuance as a first day one veterinarian. How do we expect them to talk about options to pet owners with their diploma the ink hasn't dried in their diploma yet? So that's part of that whole situation as well.
Oh, I'd love for you. Can you elaborate a little bit more on that and the impact on new grads?
Oh, absolutely. So I think if you ask any experienced practice owner now, especially if they've been in the profession for decades, they probably will all say the same thing, where these vet students, these new grads, we were never this incompetent when we graduated vet school. They can't read radiographs. They spend an hour in an appointment, all this. So they're grossly underprepared. And there's probably some truth to that. I think some of it also is seasoned veterinarians forget what it was like to be a terrified new grad. I mean, even being called doctor for the first time is like, whoa, right? So they forget. There's some disconnect there, but anyway, we can always improve things. And so I'm concerned that new graduates are missing out on a lot of vital aspects of the profession, not simply how to read radiographs or manage your day, but the business aspects to it, the client communication aspects to it. If they're not confident in their own medicine, then how do we expect them to talk to a pet owner that has a blocked cat and be able to give that pet owner options versus unblock or euthanize, right? There's got to be something in between for a lot of these cases. I think it's a lot to put on a new veterinarian to be able for them to remember all their academic learning and be able to provide a spectrum of care in the face of a pet owner in real time. That's a hard ask for an inexperienced veterinarian. So mentorship being after veterinary school, but even before graduating, being able to expose veterinarian students and new grads to that is of vital importance, I think, to honestly the future of our profession.
Am I understanding you correctly with services like vet triage? If they're offering a spectrum of care, if they are, giving options, and then this is making it back to our new graduates where they're now able to interpret, okay, this is how this veterinarian kind of handled this conversation and the options that they gave, that it might help them with their case management in the future?
Oh, I think so. I think so. In fact, I'll compare it to a brick and mortar example. You collect radiographs. You're not sure how to interpret them for whatever reason. You submit them to a board certified radiologist. That doctor sends you back a report. I encourage all veterinarians to read that report, look back at the x-rays and see what they're seeing, right? That means it's a great way. If you consider that board certified radiologist report being the answer, it may not be, there might be errors, but still we consider it the answer. Then let's take that and let's learn how to look at that x-ray so next time you can diagnose hip dysplasia or bronchopneumonia. So absolutely, at 100%. We've had calls because some of my doctors are specialists. I'm a boarded surgeon. We've had calls from veterinary partners of ours that have said, "Hey, thank you so much for last night's report. It actually gave me some ideas of what else I can treat this patient with because it's a complex neurologic condition or whatever." So it's definitely being used as an educational tool.
Yeah, I could see that being really helpful, especially, even those of us who've been out for a little while, we get stumped from time to time. So that
Mhm.
makes a lot of sense. I want to spend a minute too talking about sustainability words that we're hearing more and more like retention in veterinary medicine and how telehealth plays into sustainability and retention
Mhm.
by maybe taking some of the pressure off of brick and mortars and these in-person visits. For example, you mentioned in these remote areas where maybe there's a lot of on-call hours, maybe providing a little bit of a relief valve there, or even just even if you do have emergency facilities close by, like you said, that's not cheap. And sometimes it can be tough if a client just doesn't know if it's an emergency and they're having to go in just to be on the safe side. So I'd love to hear your thoughts on the influence of telehealth on sustainability in the profession.
Absolutely. Thank you. So I'll start off by saying that we all know by now, most of us believe that we have a culture problem in the veterinary field. Our veterinarians are retiring early, leaving the profession for other professions. They're stifled by debt. They have compassion fatigue, burnout, high turnover rates, suicidal ideations, and these are the same barriers or concerns that nurses are experiencing on the human medical side. It's the same thing. And so we have a major problem. So if you start with that foundation, so we need to figure out a solution for that. And one of the avenues that telehealth plays a massive role, and again, I hate to keep talking about vet triage, it's just we're the only ones that operate this way. So I don't want to sound too salesy. So with vet triage, for example, you asked about after hours on call. If they can eliminate the answering service or whatever their current system is for after hours on call, and instead have vet triage all of their incoming calls, and in our case, videos, that cuts down that practitioner's on call on a weekly basis by about 90%. It's a massive, massive benefit. So now when you're on call, you don't dread it as much, right? When you do get woken up, you know it's for a true emergency that a veterinarian has triage. And finally, it helps with hiring new vets. New grads don't want to be on call. No veterinarian does. But old school vets believe it's part of the deal. I have to be on call as a veterinarian. New grads are like, are you insane? I want to have work-life balance. I want to start a family. I only want to work 3.5 days a week. What are you talking about? So if that practice who's trying to entice a veterinarian to join their team can leverage the fact that they're partnered with vet triage and it's going to cut down their calls by 90%, it's a much easier sell. So it's an easier pill to swallow in that scenario. So that helps with work-life balance for after hours. For during hours, let's say you're in an emergency hospital and you're constantly running into 2, 6, 8, 12-hour wait times. Clients are getting annoyed, pets are potentially dying, whatever it may be, but you can't handle the caseload. Instead, what you do is you partner with us, and then you say, when we hit a certain threshold, decided internally, whatever that hospital wants to do, whether it's a cage space issue, whether it's a staffing issue, whether it's a wait time issue, or all the above. Maybe it's a body system issue. We can't do any more neuro or cardio cases, whatever it is. They can then turn cases away. I shouldn't say that. They can then have a first line of triage, right? Level 1 triage with a company like Vet Triage, where we would siphon out the ones that don't have to be there. And then the ones that do have to be there, they now have the room, the capacity to handle those critical cases that really should be there. And so it improves the workflow at that facility. It improves the stress on their staffing. It's flexible. If the shift is very quiet, they can take in all the cases. If they're getting killed, start vet triaging. Cornell University, for example, they use us 24/7, first level. You can't even get in there unless you speak to us first. Clients don't even bother driving in until they talk to vet triage first, and that has helped Cornell substantially with the burdens they've been experiencing. So anyway, those are just two potent examples of how telehealth can be leveraged to help with work-life imbalance and the culture issues. The third I'll mention is if you're a brick and mortar, and let's say you have a veterinarian, let's say she's pregnant, and she wants to work, but anesthetics are a danger, radiation is a danger, she can't lift things, she can't be on her feet for too long. Well, there's a hybrid modality. You can offer that veterinarian part-time work virtually from home. They can do virtual consults with clients that she has a VCPR with. So you still have an active veterinarian, right, who's still providing a service, and they can do it from home considering their situation of being pregnant. So there's some creative ways we can create virtual jobs for our brick and mortar colleagues as well, so they can work and be able to manage that work in alignment with what their current life situation is.
I think you make a really good point there, in terms of like flexibility and just creativity. I mean, veterinary medicine, to me, I think it looks totally different now than it did even 10 years ago. And so we now have these opportunities to really get creative and say, what else can we do in this profession? It doesn't have to look like, veterinary medicine is you graduate and you do this and this and this, and it looks the same for everyone. We can really, lean into some of these solutions. I was also really interested in what you said about Cornell using vet triage 24/7 and people not getting in the door without being triaged first. I'm very, very lucky to be in an area with multiple emergency clinics, urgent care clinics, multiple specialists. Have I had clients be turned away even though we have multiple emergency clinics? Yep, because they get too full and there's a lot going on. So I mean, I could see that whether you're in a remote area trying to triage on call versus, in an area where there's a lot of resources, that just having a triage, just that first line being really beneficial.
Oh, for sure. And it makes sense that if you have multiple ER hospitals and urgent cares in that area, well, then probably that's probably a densely populated area. If you look at like Manhattan, New York City, yeah, there's a ton of options, but there's also a lot of people own animals, right? And so relatively speaking, the ratio is still a problem if people are being turned away. So even if with many options, it behooves those facilities to consider some sort of partnership like that. From a business standpoint, the other thing I'll add to your comment is when we see, and again, this is business related, this is not empathy related. The critical cases are also the high revenue cases. They're the ones that are going to bring in the money. And so not only does it make sense medically that pet should be there because they're critical, but if you're a business owner, if you're a practice owner, you're worried about losing cases to vet triage, let's say, well, you actually won't. You'll see the cases that are the high ticket items anyway. And again, I hate to put it that way. But it's the reality of the profession. There's business related to it. And so usually the critical ones coming in are also the ones that are going to be the most expensive, which helps keeps the lights on, pays your staff, health insurance, all that stuff. So it actually can help their revenue. And then of course you can talk about mitigating turnover, helping with hiring, all that stuff. The online reviews by pet owners who are upset they had to wait 6 hours. So for a broken toenail or whatever. So all that stuff is a money saver when you have an outlet like vet triage you can refer cases to when you reach a certain threshold.
And probably relationships between referral facilities and general practice to say, if you have that intermediary saying, okay, you go to the emergency clinic, you go back to your general practice, then maybe we're taking some of the pressure off the emergency clinic and siphoning them back to general practices from a practice ownership and revenue standpoint.
100%. Thank you for saying that. So the relationship between general practitioners and an emergency hospital gets strenuous when the GP opens up on Monday morning and finds out their client went to ER for a broken toenail or whatever and spent all this money and all this stuff. And they thought, why wouldn't you send that case back to me? It's an ear infection. It's stress colitis. And so GPs hate that. GPs love the fact that their clients, when they have an emergency, are going to the emergency hospital. That's the whole point. But they really don't like when the ER doctor or the ER hospital works up these cases that probably could have waited for the GP to work them up. That GP wants that client back. They want to maintain that loyalty. They have the relationship with the client. They want that revenue stream. And again, ER really should be focused on critical cases that should be there. So you're absolutely right. As a boarded surgeon, that relationship between specialty ER and GP is vital to make sure all our colleagues are happy, everybody's getting fed, the pets are being managed appropriately, which is of utmost importance. That's how that relationship works the best. And virtual care can help siphon out what should go to ER, what should wait for the GP in those scenarios. Yeah.
Absolutely. Well, Dr. Ireifej, I can really hear just the excitement, the passion, the optimism for the future in everything that you're saying here. So I really appreciate the discussion. I appreciate you joining me. Are there any final thoughts you want to share?
I do think that in line with the mentoring aspect that we were talking about before, we have Vet Triage Pro now. And so Vet Triage Pro is where a clinician, doesn't matter what level of experience, but most of the ones that have been utilizing it are inexperienced. They can run a case by a veterinarian on live video, and that veterinarian is going to be a seasoned doctor. Not the same thing as talking to a specialist per se, right? If you want to talk to a specialist, you have to talk to a specialist. But if you're a new grad and you have a lame dog and you collected some radiographs and you don't really know what to do with this case and you're kind of confused, or you have some crazy metabolic derangements on a possible Cushing's animal, I don't know how to read these. Are these lab errors? Is this real? You can talk to a clinician live on video, share with them radiographs, blood work, whatever, and hopefully that's going to help. We're going to be talking to a lot of universities now about that aspect to it to help their students and interns be able to have access to a veterinarian 24/7 and stop calling the faculty on overnights or whatever when they need help. They can talk to a veterinarian reliably, quickly on. So mentorship is a massive aspect to this. And then the second thing I'll leave you off with is telediagnostics. We are going to be seeing, we already are seeing telediagnostics. It's already here, but we're going to see some pretty fancy stuff coming down the pipes in regards to telediagnostics, which I would define as the ability of a clinician to evaluate objective data points about a pet remotely. So whether that's in the hospital or in a home setting, the veterinarian can look at those data points about that pet and decide when something is of concern, or the pet owner can look at data points and the machine alerts them that this is an abnormal value. That then tells that client, I should talk to a veterinarian. And so telediagnostics they're already here, but since it's still under recognized, that's going to be a huge future part of virtual care.
I'm glad that you brought that up, because I kept hearing you say these things throughout our conversation. I went, what does he know? You're saying we can't do blood work and x-rays if we're not with the patient. We can't do an exam. We can't use our hands if we're not with the patient yet. And I'm like, what is going to happen in the future? I'm picturing like Star Trek, and we're like beaming to the patient's house and doing our exam and then beaming back to the clinic.
There are some companies out there, they're small and they're trying to spread around, that offer veterinary nurses, technicians usually, to go to a pet owner's house and collect samples that were recommended by a veterinarian. So imagine a scenario where you have a virtual veterinarian who talks to a pet owner, might be diabetic, might be Cushing's, might be whatever, liver, kidney, etc. I recommend blood work and urine, and that pet owner does not have the ability for whatever reason to go to brick and mortar. Maybe we can send out a vet tech to draw blood, collect urine at home, submit the diagnostics, and then have them follow up with the veterinarian thereafter. That's a very simple way of a virtual doctor performing blood work, urine, etc. We all are familiar with, for humans, laboratories where you go and they draw your blood, or you go there just for the x-rays, or you go there just for the MRI or the CAT scan. They've been doing that on the human side. That may be a future where that happens. The second point is accessing augmented reality and virtual reality to try and help with not only training veterinarians, but potentially even things like physical exam or assistance during surgeries. That's going to be an up and coming thing. It's already been talked about. And then I was just at ACVS, the American College of Veterinary Surgeons, their conference a month or so ago, and telerobotics are becoming a thing. And so you could potentially have a patient on the table in one state, and it's an orthopedic surgery, and there's a robot in another state that knows how to measure the anatomy and whatever else, and it can direct screw placement for the doctor virtually hands-free. And so these are things that are going to be up and coming. So when you and I are talking about like the legality, VCPR, to me, it's preschool stuff, because we are so far ahead. And the things that people are talking about and reporting on, experimenting with, are going to blow our minds. We have no concept of it right now in the grand scheme.
My gosh, the future is here.
Yeah, it's crazy. Fun.
Well, I feel like that needs to be a whole nother talk, because I have all kinds of questions in that regard. But to know my own limits and keep myself from going down and asking 15 more questions, I will wrap it up there and say thank you so much for joining me. This has been a really interesting conversation.
Thank you for having me. Thank you for everything. This has been great.
And thank you to Blue Buffalo for partnering with us for this edition of Vet2Vet. Check out NAVC's vetfolio.com for more of our V2V discussions on various topics in veterinary medicine. And remember, if one animal is better off because of you today, it's a great day.